Okay, let's talk about we understand our treatment options now. We've talked about screening patients and where do they come from. We've talked about the pathophysiology of sleep apnea, what's actually happening when the airway closes down. You've learned some terms, apneas, hypopneas, reras. We've talked about the treatment options for patients, and we mentioned dental devices, CPAP, surgical procedures, positional therapy, weight loss. Remember, weight loss, when we went through that slide series of obesity, the point we really want to drive home is that as dentists, we're interested in our patients' overall health. I mean, when you pick up a journal now and you read about periodontal disease and how that is just a pathway for pathogens into our body and things like that, you can't help but think that we need to be doing this for our patients too because it's the right thing. Where do your patients come from, Guy? I mean, in your practice, where are they coming from?
Well, when I first started doing this, as I mentioned, it was difficult to get patients out of your practice because you had to go get the PSG and lots of them wouldn't do it. Now I get quite a few out of my own practice. And I think the goal of this webinar is to get people to start getting involved in this. And I see there's quite a few questions and lots of them are going to be answered in the further series. But this is to get you interested in getting involved in this. And as you get involved, the best place to start is at home. You've already got patients who trust you, you know them, and if you just went back and started doing sleep screenings on your existing patients, it would be worth you getting educated and getting involved in this because you're going to help your patients, they're going to appreciate it, and you're going to increase your revenues. You can do things like brochures and send out things to your patients, to speaking things and so forth. The other type patients that you might want to get, and once you start getting involved in this, you start screening your patients. Are they all going to need oral appliances, Rich? I mean, are all patients candidates for oral appliances?
No, they're not. And if somebody's using CPAP and they're doing great with it, then we may be able to help them. But when we look at the outside sources for where patients can come from, one of the things I thought we could do, Guy, is if people will email us at info@dentalsleepsolutions.com, we'll go ahead and send you our screening form that you can actually start to use in your practice. And it's just kind of a break the ice kind of thing. Patients can fill out, you can start this. But
If you have any doubt that there's need for this, just give that to all your patients and you'll see very quickly.
and you mentioned brochures. Let's not forget about our co-sponsor here, Keller Labs. I know that they have some brochures and the appliance manufacturers do. And there's a lot of resources out there. The American Academy of Dental Sleep Medicine has things that you can purchase through their website. If you've never done any public speaking, you need to just get up in front of a crowd and do it. Put together a PowerPoint. And we're talking about Rotary clubs and Optimus clubs and community groups and things like that. But when we start to look outside of our practice and we're looking for another source of patients, I'm in San Antonio, Texas, and there's 20 sleep labs in San Antonio, and each one of them has their own sleep doc, and there's a lot of sleep studies being done every night. Have you gone out and met some of the ones in your community, Guy?
Yeah, I guess what I was trying to get at is if you start with the patients in your own office, start screening them. That's a good opportunity to say, hey, I have somebody I'd like to send to you. That's a great opportunity to find the sleep physicians in your area and say, would you mind if I start sending patients over? If you decide to use home sleep testing, they may help you with that. Or even if they don't, some of the people who are identified with home sleep testing are going to need CPAP. Everyone is not a candidate for a dental appliance. First of all, anybody who has severe apnea should be given a CPAP as a first line of therapy. So that's one of the best ways to get your foot through the door. I kind of call that the valve. I mean, it's kind of like opening up a water valve, and you start nurturing that, and those relationships builds and builds and builds. After a year or two, or quicker, if you know what you're doing, you can rapidly get a referral source coming in, and it just keeps coming. You've got to maintain it a little bit, but once you get that open, it's great. But don't feel you have to have that to get involved in this. All your patients in your existing practice are worth the price of admission right there, just to get going. And there's not really a big price to admission, just get in learning what you're doing, and we're hoping to do that this series and the next 5.